So a flexible sigmoidoscopy is a camera test of the large bowel. A flexible sigmoidoscope or camera, a flexible camera, is about the thickness of my little finger. It's a long camera, and the camera is placed through the bottom end, through the anus, and we pass it up the left side of the colon. It's an examination of the distal or the end half of the bowel. And the procedure normally takes about 15 to 20 minutes. It can be done with just no sedation. Some patients have gas and air sedation. Some patients want intravenous sedation, but the majority are done just with the gas and air enteroc sedation. And it's a very useful camera test to look for sources of bleeding from the bottom end. So if someone comes in and complains of fresh red rectal bleeding, notice on the toilet paper otherwise, or a little bit of a change in their bowel habit with a bit of fresh red rectal bleeding, then the flexible sigmoidoscope is the camera test we would use to have a look at the left side of the bowel only. There is another form of camera test called a colonoscopy, which is like a flexible sigmoidoscopy, except we look all the way around the bowel. But the flexible sigmoidoscope is a first line for things like fresh rectal bleeding, lower abdominal pain, and it's done after a phosphate enema preparation to clear the bowel out. And as a day case, it's a useful test because about 75% of all things that are significant that occur in the bowel, things like bowel polyps or bowel cancers, occur on the left side of the bowel, and it's a very useful tool just to make sure initially that there's nothing concerning in the bowel. It also gives us a chance to assess the bottom end, right at the bottom end, to look at things like hemorrhoids, the size of the hemorrhoids, and also then with the patients formulate a management or treatment plan for the hemorrhoids. So it's a direct visualization. It's the flexible sigmoidoscope is it uses optical fiber technology. So there's a light source, there's a lens, a camera source, and there's various other channels. So if you look at the tip end on, it's got little channels, and the camera is put through the bottom end. We channel it up, we blow some carbon dioxide into the bowel. It opens the bowel up, and we look inside the bowel about halfway around, and it gives us a direct look at what's going on the left side of the bowel. Because we can put different instruments through the flexible sigmoidoscope, we can take biopsies if we see something that needs biopsying. We can take polyps away by using various instruments like snares, and we can take direct photographs of things that we see. So it's a very useful tool. It's a gold standard for looking at the left side of the bowel. And as I've explained before, if the symptoms indicate, sometimes we don't just do the flexible sigmoidoscopy, but we do a full colonoscopy. But the flexible sigmoidoscopy is it's less time consuming, and it's specific for looking at things like fresh rectal bleeding and some associated symptoms. So the main risks of flexible sigmoidoscopy are very small. If you look at the literature, damage to the bowel wall or perforation is statistically very, very small using a flexible sigmoidoscope. There is a small risk of bleeding, especially if you take polyps away. There is a little bit of a risk of pain and discomfort when the procedure has been performed, although most of the time people tolerate it very well. But as we go around the corners and the bends in the bowel, occasionally it can cause a bit of discomfort. So the main, if you look at it on a consent situation, really the most significant thing is perforation, but the statistics of perforation are very, very, very low risks of that happening. If we give sedation or intravenous sedation, obviously there is an added risk of complications from sedation again, but these are low. So essentially, it's a flexible sigmoidoscopy is a safe diagnostic procedure, which gives us a lot of diagnostic information. So the main benefits are a direct visualization or a direct look at the left side of the bowel. Fresh red rectal bleeding is a worrying symptom for anyone. Most of the causes are benign, so when patients come in, they're quite understandably and rightly worried about the fact they're passing blood from the bottom end. So flexible sigmoidoscopy gives us a chance to have a look at the bowel and reassure the patients that there is nothing there that's worrying. And obviously, if we do find something that's more significant, something like a bowel polyp or a bowel tumor, then diagnostically it's the best way to actually diagnose it, take biopsies, although occasionally, as I say, a full colonoscopy will then be required, but a flexible sigmoidoscopy, certainly for bleeding from the bottom end and other bowel symptoms, is one, diagnostically pretty accurate, two, very reassuring for the patient if it's normal, and then if we do find benign problems, something like hemorrhoids, we can then set about organising a management plan, whether it's conservative, banding of hemorrhoids or surgery. But it's pretty mandatory to at least do the flexible sigmoidoscopy first to make sure there's no other cause of the bleeding higher up in the bowel.